fingernails. Not many people realize it, but your nails can actually tell you a whole lot about your overall health. Almost no one pays attention to this. Not even doctors. When I graduated from medical school, I had no idea that nails could hold so much information. It was only when I started studying preventive functional medicine that I really understood this topic. Your nails can tell you about deficiencies in micronutrients and vitamins, anemia, autoimmune diseases, stress, thyroid problems, and issues with your endocrine system in general. In this video, we'll go over all the signs on your nails that indicate you might have a health problem. And most importantly, by the end of this video, you'll know what you need to do about it. Before we get started, please take a moment to ensure you've subscribed to the channel, because here you'll find all the best tips and tricks on how to stay healthy, young, and beautiful. Before we move on to the signs, let's first understand how nails grow. This is the nail plate. The nail starts and grows out from under the skin right here, where the cuticle is, and it grows at a rate of about 1 millimeter per week. So, your fingers actually hold information about the last several months, even up to 6 months. For example, if someone experiences severe stress, a deficiency, or a serious illness at a certain point, it shows up in the way the nail cells divide right where the skin is at the cuticle. As a result, some pigment may appear, or there may be some deformation of the nail in that area. Then, as the nail grows out from under the skin, you can simply count the number of millimeters to figure out when that stressful event happened. And the first sign you should pay attention to and check for yourself is brittle, thin, and peeling nails. If you notice that your nail plate is starting to break down, it's peeling, and your nails are fragile, that's a sign you have deficiencies, primarily an iron deficiency. Plus, it can also be due to a vitamin D deficiency, a lack of B vitamins, and it's also related to low protein levels in your blood. In other words, if your body doesn't get enough protein, which is the building material for your nails become thin. So, friends, make sure to eat more protein. You should consume about 1 to 1.5 grams of protein per kilogram of body weight. That's at the very least. If you actually want an athletic physique, you need to consume even more, about 2 grams of protein. At the same time, be sure to get a complete blood count and a biochemistry panel done. Please check if you have any iron deficiencies, vitamin D deficiency, and then start addressing those. Once you do, this symptom will go away. The following indicator to look for is these distinct horizontal grooves. And here, you can very clearly identify exactly when this horizontal groove appeared. Just calculate. If your nails grow about 1 millimeter per week, you can figure out when your body experienced significant stress. Experiencing severe stress can be directly linked to a specific psychological event. This stress can also occur if you've gone through a serious illness. It can also be related to hypovitaminosis, a lack of vitamins, but it's more commonly associated with significant stress. And by the way, if these grooves keep appearing, it means you're currently experiencing chronic stress, and you definitely need to address that. Well, first of all, of course, you should start by replenishing any deficiencies. Start taking vitamins and minerals. And naturally, you also need to address the root cause of your stress. And honestly, when we talk about stress, it's a serious issue that's connected to the improper functioning of our nervous system. You need to learn specific skills that help reprogram how your nervous system works. And in fact, there are truly profound techniques that allow you to literally reset, to reboot your nervous system. If you want to look 5 years younger, rejuvenate your face, and get tightened, healthy body, I invite you to join my program where we will do deep techniques to eliminate wrinkles, lift faces, remove nasolabial folds and jawlines. Link in description below to join. Let's keep going. Next up, let's look at spoon-shaped nails. There are actually specific nutritional deficiencies that cause significant changes in the keratin. It starts to form quite differently, which is exactly why the nails take on that distinct spoon-like shape. And this physical sign is directly related to a chronic oxygen deficiency in the body. So when keratin, which is the structural protein that basically forms the entire nail, doesn't get enough oxygen, it slowly starts to change its shape. That's exactly why I recommend you get a complete blood count. Check your hemoglobin, iron, and ferritin levels, and then start addressing any specific deficiencies you might have. By the way, this can also be related to chronic blood loss. If your body is constantly losing blood, that can also cause anemia, which in turn can change your nails. So, it is important to make sure to get your blood checked to see if you might have anemia. Friends, let's keep going. The next sign is longitudinal ridges. These are those vertical ridges you can see on the nails. This condition is primarily related to your physical body, not getting quite enough essential fluids to function properly. In other words, dehydration, meaning your body is lacking water. Yet another potential reason for this could be, once again, a significant lack of protein in your daily diet. The next sign is hypothyroidism. If your thyroid gland is not functioning as effectively as it should, it can lead to a situation where your entire metabolism begins to gradually decelerate. And when your metabolism slows down, that also shows up as these longitudinal ridges. Also, vertical ridges running down your nails can indicate that you have a magnesium deficiency. So, friends, pay very close attention to exactly how much water you're drinking. Start taking magnesium, get your blood tested, check your thyroid, and you should see this specific symptom start to disappear. The next sign to look for is white spots. These spots can be single, or there can be a lot of them. Whenever you notice that these white spots start to show up, it is usually directly linked to a zinc deficiency. Sometimes it can indicate a calcium deficiency. And these small white spots can also frequently appear because of very minor physical injuries. For example, if you injure your nail right now, your nail matrix, the area where cell division happens, reacts, an error occurs, and as the nail grows out, you can see that, say, 5 or 6 months ago there was some kind of injury. Also, keep in mind that white spots can sometimes appear when there is a fungal infection on the nail. There's also a situation where multiple white spots appear and the entire nail turns white. And this is actually a bad sign that points to liver problems. So, friends, if you have a lot of white spots, get your blood and liver checked. If it's just a single spot, pay attention to whether there might be a fungal infection. It could also potentially be from a physical injury. If you happen to remember having one, you should start taking zinc, calcium, and B vitamins. Friends, the next sign I want to talk about today is when you see pale or even bluish nails. This almost always indicates a significant iron deficiency or a deficiency in B vitamins. But most importantly, it reflects that there are already fairly serious problems with the cardiovascular and respiratory systems, which eventually leads to cyanosis and chronic oxygen deprivation. That's why you definitely need to get checked out. By the way, there's also a simple test for this. If you press firmly on your fingernail plate, and then quickly release the pressure, the healthy pink color should return to the area within 2 seconds. If you press and the color doesn't come back within 1 or 2 seconds, that means your microcirculation is impaired. In this case, I recommend seeing a general practitioner and a cardiologist. Friends, to wrap things up, I want to give you some exercises you can do right now, as usual. First of all, you can start by warming up your hands. It is also really helpful to repeatedly clench and unclench your fists. This simple movement stimulates the microcirculation in your fingers. Just do this regularly, and you will be able to significantly improve the overall nourishment of your nails. Of course, this doesn't mean you shouldn't take the time to address any specific deficiencies in your body. But with these exercises, you can also significantly boost your internal blood flow, so your nails will start to look much healthier and more beautiful. What else can you do? You can try an osteopathic technique. That is, you can take your nail plate and slowly start making circular movements like this, kind of articulating it, right? Just take it like this and carefully twist it all the way around. You can do this with each nail. This is incredibly effective as well, because you're stimulating the area where cell division is actively taking place, or the nail forms directly underneath the cuticle. That's all for today, friends. I hope you found this helpful. Let me know in the comments which sign you noticed in yourself. I just want to analyze how common this problem really is. Wishing you all good health. This was Dr. Alice with you. See you next time.